I just like dancing to that music. I don't know why. Welcome back this week for another episode of the T-Bone Speak Show. And I want to thank each of you that are watching. And I got a favor to ask of you. If you could do me a favor and share this show, leave a comment, leave a like. We are committed to making this even better and keeping it going forward. So I need your help to make that happen. And so let's give me a second and we're going to come back for the news. And in this week's news segment, I want to give you some updates, okay? So, in this week's news segment, we're going to give you some updates. So recently, there has been a class action lawsuit filed against Wells Fargo for allegedly unfairly shuffling Paycheck Protection Program applications. So what the lawsuit alleges is that Wells Fargo was giving preferential treatment to larger businesses with larger loans and overlooking some of the smaller businesses and smaller loans. Now, I don't know where you stand on this, but frankly speaking, I don't have that big of an issue with it. It is wrong. It is not great, especially when the Small Business Administration said applications would be processed on a first-come, first-served basis. Obviously, that's not true or allegedly not true in this situation, but this is not that different than the way life is at the end of the day. You give priority to your priority customers, and they've given priority to their priority customers. The lesson in this is work with a local bank who will provide you service and support, and you probably won't have this issue. Dentists are reporting the financial impact of COVID-19 on their practices. So 4 in 5 dentists have closed their practice except for emergency, according to the ADA. I don't know which 20% of dentists are still open beyond emergency care. That's a little scary. And the COVID-19 crisis has caused a significant financial impact on dental practices, with collections down to about 5% of what's typical. Not down 5%, but down to 5% of what's typical. Now, I do have something to say about that. Last week's business tip, I talked about how we should be focused on AR and collecting patient and insurance balances because that number has no reason to be at 5%. We have outstanding insurance and outstanding balances that should be giving us 15, 20, 25% of our normal monthly payment. And really what this means is that we have taken shutting down to mean we do nothing, which is its problem in of itself. So the ADA does a survey every couple of weeks, and I think they're busy doing these surveys and not fighting for legislation that actually helps us as dentists. Dentists in Indonesia are not immune from COVID-19, and they are dying as well. So in the entire country of Indonesia, 24 medical professionals have passed from COVID-19, and 6 of them, so 1/4 of them, were dentists. So the entire country of Indonesia, as of the time of this news story given to me, 6 dentists had died. Indonesia will never be the same without 6 dentists there. So we want to be wary of that for sure, okay? And Brazilian dentists are feeling the same pain that we're feeling. They will not be going out and dancing and all that stuff because they are feeling a shutdown and lockdown as well. And 13,000 reported cases of COVID-19 in Brazil with 667 deaths. And the dentists across the country have decided to shut down and do their part as well. So thank you, Brazil, for doing your part. Enjoy your time at home. And we look forward to the time that we can get back to work along with you to help people get along. Now, on a little bit more of a serious note, we do have to think about, is widespread antibody testing the key to reopening our country? And this is something that really could affect dentists. So I want you to pay attention to this. So we are moving towards a pinprick antibody test that will, in 5 to 10 minutes, tell us whether or not our patients have the antibody for COVID-19. And this could be important in a couple of different ways. Number one, it could be a way that dentists, if we get approved, could be on the front lines of testing the population at broad for this type of antibody as a way to help bring in revenue to our practices. But more practically and probably more importantly would be the ability for us to test our patients to minimize our risk for exposure to the coronavirus/COVID-19 by being able to do these tests. I don't know how I personally feel about this. Sometimes we're better off just not knowing and having universal precautions and being very safe with everyone, because all of these tests are going to have a false positive or negative rate to them. So we do have to get some more information on that. And as of right now, 3 companies have received emergency approval from the FDA to sell antibody tests. So, we'll see where that goes. So do keep an open mind about possibly doing antibody testing in your practice to help the public at large. And finally, in today's news, I don't know how you guys are dealing with this, but many parents working from home or dealing with kids at home are having funny things. So as you can see in this picture on the right-hand side, this lady is doing a work-from-home webinar or a Zoom conference, and there is Spider-Man in the background on the dining table, which apparently is her child or someone else's child that has entered into the home. And then that poor guy, that's how I feel, is trying to do work from home, and he's got his kids all over them. And this is where we would look at him and say, can't you get control of your kids like people do to me when we're at the airport or the grocery store and my kids are running wild all over the place. So why don't you do us a favor and leave a picture or a comment of a funny news story or a funny story of you dealing with your kids or how you're dealing with your kids at home during this time.
So I have a question for you today. Remember, if you have any questions, you can go to www.asktbone.com and we will answer your questions. So this is very straightforward. We must have some people doing some online quarantine shopping. How can I incorporate a CBCT into my practice?
That is a phenomenal question. And I could go on for hours on that because you know how I love CBCT.
Yeah.
So let's talk about a couple of specific ways that people can implement 3D imaging in their practice. So I always want to look back to, why did you buy 3D imaging, okay? And the truth is most of us bought 3D imaging so that they could diagnose and see better. Okay, so if we want to see better, then we need to take the x-ray. So the most important and first tip that I have for anybody is actually taking the x-ray on their patients. So in other words, make it a standard of caring in your practice that you take a 3D CBCT on the vast majority of your patients, okay? So that's super, super important to do. The second thing I would do in terms of implementing this into your practice is I would prioritize what procedures are most important to you. Now, I have forgotten that when I bought CBCT many years ago, that it was really at that point just for implant dentistry in diagnosis. But today, CBCT plays a role in diagnosis, certainly, implant dentistry, sleep apnea dentistry, endodontics, overall things like that. So don't get overwhelmed with all the different things. Pick one, get pretty good at it, and then add the second thing, then add the third thing, and go from there. But my suggestion in the very beginning is focus on taking the CBCT on nearly all your patients, teaching your team members how to take the CBCT, teaching your team members how to pull up and manipulate the software, and then teaching team members how to show and communicate with your patients and communicate with your patients what you're seeing, so that when you walk in, some of that wow factor is already done for you. So that would be my focus on implementing CBCT starting out, and then a step-by-step fashion of implementing all the clinical techniques that are available from CBCT. All right, so this week's clinical case, let's take a peek. So let me walk through and give you an introduction and walk you through the case. So this week's case is a wonderful gentleman that came to our office who had some bonding on tooth number 9, 2-1 for those of you that are internationally viewing. And what happened here is the bonding broke on tooth number 9, as you can see a little bit closer here. And so this was an old-time injury that had some bonding done as a teenager, and now as an adult, the bonding is finally broken. So here's a closer look at how everything looks and the decision that we have to walk through on this particular patient, okay? So our close-up pictures. So the first thing I did in this case was we took a step back, because at the end of the day, if we take a closer look at this, there's a lot of choices here. And so I wanted to walk through the patient and give them the choices on how this, what their choices were. So in this particular case, we decided to do some cosmetic imaging. So again, we started with this photograph, and what I did is I first showed the patient what it would look like if we literally made tooth number 9 look like tooth number 8, whether that's through porcelain or bonding, but just working on a single tooth. But the other thing I noticed, and we talked about, was that I thought tooth number 8 and 9 were a little bit long in this case. So then we showed him what it would look like if we shortened those teeth and made them a little bit shorter, and to see how he may or may not like that. And then the third option was looking at doing both teeth to close the gap to see whether or not he enjoyed or liked the gap between his teeth. After seeing the imaging, he decided that he wanted to close the gap and get everything taken care of. So our treatment plan in this particular case was to whiten his teeth and do porcelain veneers on tooth number 8 and tooth number 9. And so the next step after we did the whitening and gave it time for everything to settle was to do some shade photography. So here we took some photographs from different angles and at different exposures, so that way we could better communicate to our laboratory different angles and stuff, so that the lab can get an idea of recreating the translucency, the chroma, the facial texture that exists on this patient to give us an idea here. So we took these photos. Now, a good tip is I believe these photos need to be taken before you numb the patient, before you dry up the teeth and do all of that stuff, before you take any impressions, so that the teeth are hydrated and any type of shade changes aren't occurring unnaturally there. So you're capturing them, and I want you to capture them from different angles at different exposures, so you can show, so your flash doesn't drown out some of that information. And then we're ready to prepare our case. And in this particular case, we're going to do some feldspathic veneers at the time we did this. So that's going to require 0.5 millimeters of facial reduction. So we go ahead and use depth cutting burrs. We work with Meisinger here at 3D Dentists and TBone Speaks. And Meisinger provides some phenomenal burrs that will do the depth cutting here. And these are 0.5 millimeter depth cutting burrs. And then we go ahead and do that on the facial of tooth number 8 and the facial of tooth number 9. Once we do these depth cutting burrs, we take a medium or a coarse burr. In this particular case, I don't remember the number, but I want to say that's probably at 850.014 or something along those lines, and go ahead and connect the dots and remove all our depth cuts, so that way we can make sure that we do have enough reduction space. Then I come back in with the end of the depth reduction burr, and we go ahead and remove about 1 millimeter from the incisal edge of tooth number 8. We don't have to remove anything from number 9 because it's already been, in a sense, over reduced for us naturally. So we go ahead and flatten out the incisal edge of tooth number 8, and then at this point we go ahead and place some retraction cord, so that way we can get a good quality impression. And I use a single piece of cord to go all the way across from tooth number 7 to number 10 and get that in between 8 and 9. And then we're going to come in with a fine diamond, and we're going to go ahead and smooth out our prep on tooth number 8 and 9, paying close attention to get a very smooth prep and a very good margin, and drop that margin slightly below the tissue level. And the cord helps move that tissue level down and helps protect our sulcus from initiating any bleeding. And then once we have our prep completed, I then take some type of sandpaper disc and go ahead and smooth out our preparation so that we don't have any sharp angles and everything is nice and smooth. A smooth prep makes impressions better, it makes the model work better, it makes the laboratory work, and even in the digital world, everything becomes better with smooth preps, especially with some of the milling that occurs with these modern CAD/CAM systems. So here's our final preparation, all smoothed out and ready for our final impression, whether it's digital or analog. And then here is our final result for this patient, his smile before and after, his retracted with slightly open, and then a close-up view. And I apologize for the tissue. This was taken immediately after cementation. And here you can see a 3-shot view showing how nicely in the smile on that left photograph there, how nicely that blends in with the surrounding dentition, and certainly a significant difference in the way our patient looks. So that's our clinical case for this week. So our business tip for the week is pretty simple. Listen, I know we're all trying to time this PPP and trying to get it at the exact right time. I know we're not open yet, and some of us may be open in the next few weeks. Some of us may not be open for a month. But here's what we've learned from the first round of the PPP. There's not enough money. Look, at the end of the day, they didn't touch even close to 5% of small businesses out there. Go ahead and stop trying to time this. Stop trying to be fancy. Take your PPP money. We don't know when it's going to be ready. Get your applications done. Call your banker. Get everything in line and get the information from your payroll company and have everything ready, because even if you applied before, don't wait for them to call and say you got to reapply if that's the case. Get everything ready. Take control of this for yourself. Call and annoy and bother people until they give you the answer that you want, okay? So focus on getting your PPP taken care of, okay?
Hi everyone, I have an update in the 3D dentist world. So as our courses are now on hold in person, for now we do have online virtual learning coming, but in the time being, join us on Tuesdays at 11 a.m. We have 3D dentist webinars, and you can register for those at www.3d-dentist.com/webinars. You can also replay the last couple weeks webinars if you've missed those at www.3d-dentist.com/growth. If you have any questions, feel free to submit them to www.asktbone.com, and we'll hear from you soon.
And listen, everybody, I want to thank you for taking the time to tune in to our show on a weekly basis. I hope you find it a little bit funny, a little bit serious, kind of like a good blend of truthful information. I try to, kind of bring all the stuff together for you. And do me a favor, hit that like button, hit that share button, and help us out. Leave us a review on the Google, on the Apple Podcast, on Slack. I don't care where the hell you leave it. Just leave me a review, okay? And be sure to send us some questions because we need your questions at www.asktbone.com, and you can leave voice questions by calling 510-698-2663 and leave a voicemail question for us. We will see you next week.